Family First by Bailey, Natalie, and Satin. We are a human service program that helps decrease the rates of neglect and physical abuse. We are located in Jacksonville, Florida. Our contact person is Bailey Flowerdew, and you can reach her at the following email.
What we stand for. Family First strives to decrease the rate of physical abuse and neglect within the Jacksonville community. Our child care service workers will conduct community-based assessments, providing family with proper prevention, intervention, and treatment strategies to help reach our goals.
What we plan to do. Our goal at Family First is to decrease the rate of neglect and physical abuse within the Jacksonville community. We will be doing this by having trained child service workers, partnerships with programs that provide parent-child interaction therapy, safe care, trauma-forced cognitive behavioral therapy. Our activities are to conduct initial home assessment to identify cases of neglect and physical abuse, implement parent-child interactions therapy sessions, deliver safe care interventions, provide trauma-focused cognitive behavioral therapy for affected children, and also implement child removal in severe cases. Our outputs are to complete home assessment with findings and risk level identify, conduct parent-child interaction therapy sessions, implemented safe care interactions in identified household, provide trauma-focused cognitive behavioral therapy sessions to children, and also to complete child removal process in severe cases. Initial 50% increase awareness of neglect and physical abuse issues within Jacksonville community. Measurement indicator pre and post test assessment score. Intermediate 80% improved parenting skills and child-parent relationships among families receiving interventions. Measurement indicator pre and post test therapy assessments. Long term 30% decreased rate of neglect and physical abuse cases reported in Jacksonville, Florida. Measurement indicator follow-up assessment of children living conditions and well-being post-removal.
Our program works by having our child care service workers conduct at-home assessments. These assessments help the families have a decrease within the household of physical abuse and neglect. And with the partner programs that the families connect with, there will be parent-child interaction therapy, safe care, trauma-focused cognitive behavioral therapy, and then the parent-child interaction therapy, which addresses at-risk families through effective parenting strategies and proper child development. Safe care addresses home safety, child health monitoring, management strategies, and parenting skills. This intervention is strategically implemented into families that label neglect on their home assessment. And then trauma-focused cognitive behavioral therapy addresses the psychological effects that the children face when they become victims of physical abuse or neglect. Children in the homes have indicated if the children in the home have indicated physical abuse or neglect, then they will receive this treatment.
When looking at our population for Family First, we looked at the cases of neglect and physical abuse within Jacksonville, Florida. By looking at statistics, we learned that there were 619 cases of neglect and 127 cases of physical abuse. which gives us our total of 764. Given the size of our program, we had to be reasonable with how many children we could reach. With our number of employees and the size of Jacksonville, we determined 50 children was a good target population size. Out of the target population, only a percentage of children experience an impact. The typical impact percentage is around 70%, which means about 35 children will experience an impact from our program. Jacksonville, Florida faces significant challenges in family dynamics. This leads to higher rates of family conflict and instability compared to their neighboring counties and the state average. When looking at data from the Florida Department of Children and Families, it reveals that in 2023, Jacksonville had a reported rate of family conflict cases at 1.75%. This is higher than the statewide average, which is 1.53%, and higher than their neighboring counties. The high level of family instability contributes to a high number of children experiencing neglect and physical abuse, which surpasses the state and national average. In 2022, Jacksonville reported 2.4% of children enduring neglect, which is higher than the state average of 2.43%. Their physical abuse rates were also higher. Jacksonville reported 0.5%, while the state reported 0.3%. With the prevalence of family instability and elevated rates of neglect and physical abuse, there is a pressing need for intervention programs within Jacksonville. Family First is identified as a suitable program to address these challenges, which decreases the incidence of neglect and physical abuse among children in the community of Jacksonville.
We believe this will work because of the ineffective coping strategies. We want to take charge of those, the societal norms that condone violence and accept aggressive behaviors, the lack of social support that the families have or the children, and the stressors of traumas within the home like poverty, substance abuse, domestic violence, or even mental illness.
Our program will first work by having our child service workers conduct home assessments. Once the assessments are completed, the child service workers will identify if there are risks present in the home, neglect, and/or physical abuse. Depending on what is identified within the home, our program will put families in contact with our partner programs to ensure that they receive the proper intervention. If there is only a potential risk identified within the home, we will connect the family to a preventative program. Our partner program is parent-child interaction therapy. This type of therapy focuses on improving the relationship between the parent and child. This has been proven to decrease abusive behavior by parents. Parental therapy will involve teaching effective parenting strategies, proper child development, and coping strategies. Child therapy will address any behavioral problems that were identified in the home assessment. If only neglect has been identified, then the family will be connected to the Safe Care Intervention Program. This program will decrease neglect by safety-proofing the home and teaching the parents how to monitor and manage their children, as well as parenting skills. This program has been found to decrease the rate of family referral to Child Protective Services. Trauma-focused cognitive behavioral therapy will be connected with families that have identified physical abuse or physical abuse and neglect. This treatment program will help victimized children cope with their experiences. Children who are victims of abuse are more likely to develop depression, anxiety, and PTSD. The CBT aspect of this therapy will use psychoeducation, relaxation skills, and emotional regulation to help teach children how to cope with their experiences. Trauma-focused aspects will help the child cope with their traumatic experiences as they remember them. This treatment also works as prevention. Perpetrators of abuse tend to be victims. By going through this treatment, it decreases the chances of the cycle continuing.
How much would it cost? Our total grant amount is $135,415 with 49 cents. The direct cost is $109,206 with 4 cents. The salaries is $50,003 with 20 cents. Our fringe benefit is $3,825 and 24 cents. For supplies, it is $5,000. Equipment is $10,000. Travel expenses is $11,577 with 60 cents. Our consultants' fee are $28,800, and our indirect cost is $26,209. Our salary is $50,003.20, and this is for a full-time workload, which include 40 hours per week and 52 weeks per year. And our hourly rate is $24.04. Our fringe benefit, which is $3,825.24, is benefits and taxes, which is 7.65% of the total employee salary. Our supplies is $5,000, and this will be used for materials for home assessments, intervention, therapeutic activities. Our equipment is listed as $10,000, and this is to be used for laptops, tablets, communication device, printers. Our travel expenses is $11,577.60, and this is for transportation for home visits, training sessions, collaborations. And our consulting fee is $28,800, and these are specialized trained and technical assistants.